What if I tell you that trauma has a significant effect in your life, in your health, and in your soul? What if I tell you that trauma can affect the physical health at the cellular level? And what if I tell you that meditation has been proven to lengthen the telomere, which means meditation can help your longevity and quality of life? So stay tuned. This is Dr. Raul Enad from Cadenza Medical Clinic. We will go through the different definitions, the mechanisms of how trauma, the gut, the brain, and the immune function are connected, and how meditation means so much. Trauma is known by many people. It could be the big T. The traumas would be if you're exposed to the war, if you're witness of a very horrendous crime, or rape, or even catastrophic event like natural calamities like earthquake. Experiencing those consists of big trauma. The small trauma would just come in as inadvertent or even unintentional neglect. For example, a 5-year-old girl or a boy who would come up to his mother asking for help because he's been chased upon by his siblings. And the mother would just shove the kid away and say, if you do this again, if you're going to make trouble again, without even asking who's to be blamed, the child will just retreat, withdraw, and this will have a lasting scar eventually. Trauma is not caused by biochemical defects in the body or in the brain. It is something in the psyche, in the development of the mind. Neurophysiologically, this has been proven that the different centers of the brain are affected. So let's go one by one. The first that's affected is that when you're traumatized, different senses or sensory perception, for example, the smell of the attacker, or the sound of the guns, or the scenery, the colors associated with the traumatic scene. The trauma in itself heightens the amygdala and deactivates the prefrontal cortex, such that some of these patients who are traumatized will not have memory of this. You have to extract it to be able to take away the turbulence from within. The other thing is that when you're traumatized, the other centers of the brain, like the anterior cingulate cortex, is affected. It's deactivated. Well, this anterior cingulate cortex is responsible for processing emotions, just like the limbic system, hippocampus, and the amygdala. If you're not able to process emotions, patients with trauma will have a propensity to disengage and not being able to engage with a meaningful relationship with anybody. So it becomes a problem having a relationship, a meaningful relationship, because of trauma. Well, the other parts of the brain, like the insula, for example, is also deactivated, which is also responsible for integrating all these impulses to the brain, such that patients with trauma can manifest with dissociation. Sometimes they can see from above, from the surface, that they're seeing themselves in the scene as they get flashbacks or nightmares. It is important to know that also the reptilian brain, or the lower hierarchy of the brain, is also activated when you're traumatized, such that when you're traumatized severely, for example, a rape victim or somebody who is shell-shocked, these patients will literally be in freeze mode because of the deactivation of the connection from the amygdala to the prefrontal cortex.
Stress. When your brain detects a stressful situation, your HPA axis is instantly activated and releases a hormone called cortisol, which primes your body for instant action. But high levels of cortisol over long periods of time wreak havoc on your brain. For example, chronic stress increases the activity level and number of neural connections in the amygdala, your brain's fear center. And as levels of cortisol rise, electric signals in your hippocampus, the part of the brain associated with learning, memories, and stress control, deteriorate. The hippocampus also inhibits the activity of the HPA axis, so when it weakens, so does your ability to control your stress.
So all these things are happening in the brain. What about the gut? Studies have shown that traumatized patients have the propensity to have leaky gut or dysbiosis, meaning the microbiome, the good bacteria in the gut, primarily at the second part of the intestine called the jejunum, where the micronutrients, the trace minerals are absorbed. This is also responsible for the dwelling place of the microbiome. Studies have shown that if you're traumatized, there's a change in the population of the balance, especially of the good bacteria and the bad bacteria, with predominance of this bad bacteria that produces neurotransmitters that are hyperexcitable. These neurotransmitters, for example, like the serotonin, is 90% produced in the gut by the bacteria as well. It produces, by fermentation, the fiber that we eat, short-chain fatty acids that's responsible for feeding this microbiome and also heals the gut.
Well, I mean, the gut, I would say, is after the brain, the most complex organ we have in the body.
Okay.
It's not just a it's a tube from the mouth to the anus. And for a long time, digestion and absorption and storage of waste has been sort of the main focus of interest. In the meantime, we know that 70% of our immune system is embedded in the gut. Big portion of our hormonal system, endocrine system, is embedded in the gut. There's a separate nervous system in the gut, which is called the little brain.
Butyrate, propionate, and acetate. But you need the fiber. Fiber needs to be there to be fermented by these bacteria to produce the short-chain fatty acids. So you can connect how diet is very important. The other thing is that when you're traumatized, there are many other things that can happen. When a patient is traumatized, other things can happen, a cascade of inflammation that can happen. This is because once the amygdala is heightened, the sympathetic nervous system, which is part of the autonomic nervous system, which consists of sympathetic and parasympathetic, is heightened, the sympathetic tone, which in layman's term, sympathetic is fight, flight, while the parasympathetic tone is rest and digest. The other thing is this: the cortisol goes up. This is a stress hormone. The cascade of inflammation goes on. Cortisol increases the sugar. Sugar provokes inflammation. When we talk about inflammation, we're talking at the cellular level. We're talking about increase in the hsCRP, or high sensitive CRP, which is correlated with acute events like heart attack and stroke, or infection, for example. These are markers of inflammation that we need to know. WBC, or the white blood cell count, is also increased. No wonder if you have steroids in the hospital, for example, if you're taking steroids, WBC, or the white blood cell count, increases. Your sedimentation rate increases. So these are evidence of inflammation in your body. Take, for example, the death of John Paul I. John Paul I died in relation to anger, which we're going to discuss in another video. Acute sympathetic overtone can cause inflammation, cholesterol crystals, which pokes the plaque and allows the sticky substances like atheroma outside of the plaque to attract other platelets to form a clot. If the blood vessels is supplying the heart or the brain, that's the event of heart attack and stroke. So in essence, sympathetic tone needs to be switched all the time to parasympathetic tone. And I can give you now the most effective way of switching that from sympathetic to parasympathetic is meditation. And the best meditation there is not yoga, it's not Buddhist meditation, it's the unconditional love meditation of the Passion of Christ, his unconditional love for us, which he prepared even before he was born and recruited his mother, the Blessed Virgin Mother, to be part of this plan of his passion. He created this woman, immaculately conceived in the womb of Saint Anne, to be worthy of becoming the vessel or the container of the Son of God in her womb. So these are all connected. The passion, the joyful mysteries of the Rosary is part of the sorrowful mysteries of the resurrection. When you meditate, in essence, you are inhaling 4 counts, you hold 4, you exhale 8, and you hold 4. Inhale 2, 3, 4. Hold 2, 3, 4. Exhale 2, 3, 4, 5, 6, 7, 8. Hold. 2, 3, 4. Now this exercise tones the vagus nerve. This vagus nerve is the nerve supply of the autonomic nervous system. In a polyvagal theory, there are two divisions of the vagus nerve. One is the ventral part, which is essentially the parasympathetic tone. You're relaxing and digesting. You need to tone that. When you say toned, you are to exercise that vagus nerve. Just like having a muscle, you flex all the time, you get your muscles toned. Well, that's the same thing with the vagus nerve. You need to tone it. It is important to know that meditation can be done incorporating the teachings of the Catholic Church. Well, the Catholic Church does not really say that you need to breathe in, breathe out. I am a Catholic doctor, and I am able to say that without my practice of meditation, doing the incorporation of the breathing as what the Eastern meditation is doing, and focusing on the Blessed Sacrament, I would not have been healed by the effects of sleep deprivation, triggering my sympathetic tone, causing the symptoms of heart rate of 220, which is a piercing pain in the chest. Thanks to my previous work, I was able to experience this and able to relate to you. With meditation, I was able to correct, and with the research that I have done through the years, that I was able to experience the relief, that I didn't have to take any medication or beta blockers that was recommended to by my friends, cardiologists, and to ablation or anything, that I'm able to live now without tachycardia. I'm now able to play tennis and do my workouts and able to impart to you what's happening and during those times of stress. That would create this. Take, for example, my patient who was traumatized because of a very traumatic event related to car accident, and there was death involved, and he had to go to prison because of that. He could not contain that feeling, that questioning, why am I going to prison, when in fact it was not my intention. Those two aspects that destroyed his psyche triggered sustained increase in sympathetic tone that made him suffer for anxiety most of his life after the trauma. At one point, he got a blood pressure of 220. He had to be admitted in the hospital and be taken care of. And guess what? Doctors would just put the blood pressure, rightfully, on blood pressure medicine without addressing the underlying trauma. Thanks be to God that he went by and stopped by the office and thought about trying my regimen. It's not a secret, it's by theory. We were able to gradually stop the blood pressure medicine. Thank God he has no more, there's no need for him to maintain on a blood pressure medicine. He's been running regularly, bicycling with the way he loves it, eating well, non-inflammatory food, which is no sugar. And we also tested some allergens, food allergens that would trigger inflammation. All these things are connected. The center of these is meditation. Take, for example, the latest finding. When you meditate, it actually lengthens the telomeres. What are telomeres? Telomeres is the end cap of the DNA. That DNA, or that telomere, chips off every time the DNA replicates. So as it replicates, as you grow older, the telomere shortens, and it's enhanced or expedited shortening if you're traumatized. Well, a new finding has shown the correlation of meditation and the lengthening of the telomere. It is very accessible and it's very reproducible. You breathe in 4 counts, hold 4, exhale 8, hold 4. We don't need to do Buddhism meditation or yoga meditation because according to the exorcist of Rome, these type of meditations are portal entries of our enemy because it's centered on self. It is pride. That's the favorite of the enemy. I'm talking about the demon, the devil. But if you do a Christian or Catholic meditation, it is Christ-centered. It's Yahweh who is the breath of life. We're adoring him. We're humbling ourselves in front of him. A grace that you cannot really describe. During meditation, you can feel something, an emotion, makes you cry sometimes. But according to Father Leandro, my spiritual director, he said, it is not a feeling, it is actually the motion of the Holy Spirit that stirs your heart in a peaceful dwelling place. That's the second part. You discourse about your passion in relation to Christ's passion. Like a friend, you talk about your problems. The more you get to know each other, then you become so strong in bond. That exercise of guided breathing has a tremendous effect on your heart rate variability. There's more variation on your heart rate in relation to your respiration.
Right? Normally, if you hear something like heart rate variability, sounds like a bad thing. Turns out it's a great thing. Heart rate variability is essentially the distance, or the time rather, between beats of the heart. So you might think that it's great to have a really consistent heart rate, boom, doom, or actually in reality it's more like doo-doom, doo-doom. And I'm missing some of the beats within the waveform, but you get the idea. But actually, it's well known to be correlated with a number of positive health outcomes, including things related to brain and body and longevity and performance, to have high heart rate variability. Heart rate variability is going to lead to a pattern of heartbeats that is more like dun 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 dun. Now, you might say that's arrhythmia. But there are cases of arrhythmia that are good, and there are cases of arrhythmia that are bad. Higher HRV in general is a good thing. You want it during sleep, and you want it during wakeful states.
Meaning that translates that increased heart rate variability or increased variation of your heart rate in relation to your respiration is correlated to the parasympathetic tone, staying away from the sympathetic tone. So inflammation is less, your brain is calm, your memory improves because the hippocampus is infused more with blood supply, which is a center for memory and joy, as opposed to the amygdala, which is deprived of the circulation when you meditate. Serotonin increases, and this is the happy pill. Remember, 90% of serotonin is not produced in the brain, but is produced in the gut. GABA is increased, as opposed to the glutamate that is increased when you are excited. The glutamate is converted to GABA by vitamin B6. That's why vitamin B6 and foods rich in vitamin B6, like liver, greens, especially the cruciferous vegetables, is important in the healing process. So you cannot just pop a pill. It will not do it, because that is just temporary relief, and it actually would numb and prevent yourself to process the trauma associated with it. What is the role of fasting? Fasting, just the same, increases your heart rate variability and switches your sympathetic tones to parasympathetic tone. So as I'm digressing and progressing here, my point is that trauma exists. It increases sympathetic tone, increases your cortisol level, and creates inflammation. And the remedy are the following: meditation, fasting, and non-inflammatory diet. Well, let's add exercise, corporal mortification. How is it integrated in the healing of a traumatic patient? As you know, exercise effects goes like this. Serotonin increases, so you become more happy. These are the happy neurotransmitters that is noted to increase when you exercise. The BDNF, the brain-derived neurotropic factor, is increased when you exercise, and this helps heal the pruned neurons. It will allow regrowth of these neurons so that the brain becomes connected, the neurons becomes connected and allows the functioning of the brain anew. This also is improving in terms of producing BDNF, because BDNF stimulates the brain to do more exercise. So it's a catch-22 that you have to make a leap of faith of just making a step of exercise, because this has been proven to prevent or fix or heal you from the anxiety associated with trauma. I tell my patients other ways of practicing meditation would be to do the breathing in and out, and do it with the beads of the Holy Rosary, especially the sorrowful mysteries. Hail Mary is the rhythm. You don't have to be so dramatic about the Hail Mary, full of grace. No, it's the rhythm. but you have to think about the scene of the Rosary as you are saying the Rosary, as you're saying the Hail Mary. The same with the chaplet of Divine Mercy. There are 5 sections of the Rosary bead. Each section, you think about the sorrowful mysteries, such that in the first set of the 10 beads, you can incorporate, for example, as you recite, for the sake of the sorrowful passion, you inhale, you exhale, have mercy on us, sinners. You go through the 10 beads, thinking about the agony of the garden, and you go on again in the second, with the scourging of the pillar. Better still, every time you say a Hail Mary, or the chaplet, or the chant, let it be an honor of every whip that Jesus has endured. It would be easier for you to connect. The crowning of thorns, powerful scene. If you recall the scene of the crowning of thorns in the movie The Passion, it was not just like a crown. It was pushed and pushed until Jesus was bleeding in his head. So let it be every time you do a Hail Mary reflecting on the crowning of thorns. Every time you do a Hail Mary, think about the thorn that was piercing every time. Let it be meditated upon when you do a carrying of the cross. Every time he was moving, carrying the cross, he was hurting in his wound in the shoulder that was as a result of the abrasion from the rugged wound, or the rugged wood of the cross. Let it be during the crucifixion, you meditate on the scene around. The Virgin Mary crying, John, and the women, the pounding of the nails. You listen to that every time you do the Hail Mary and every time you do the chaplet. Everything has to be put out there and unite the passion of Jesus in all your passions, your sorrows, or even your joys. Meditative Rosary, the chaplet of Divine Mercy, or the Jesus prayer, is very profoundly powerful. It has a physiological effect in the brain. It has a physiological effect on the intestine. It lengthens the telomere, which increases your longevity if you want to.
This is selected for our first study, a group of such caregiving mothers, and we wanted to ask, what's the length of their telomeres compared with the number of years that they have been caregiving for their child with a chronic condition? So 4 years go by, and the day comes when all the results are in. And Alyssa looked down at our first scatter plot and literally gasped, because there was a pattern to the data. And it was the exact gradient that we most feared might exist. It was right there on the page. The longer, the more years, that is, a mother had been in this caregiving situation, no matter her age, the shorter were her telomeres. And the more she perceived her situation as being more stressful, the lower was her telomerase and the shorter were her telomeres. So we had discovered something unheard of. The more chronic stress you're under, the shorter your telomeres, meaning the more likely you were to fall victim to an early disease span and perhaps untimely death.
Let me repeat the saying of Saint Josemaria. If you want to know Jesus, you need to know his passion, and that's in his work, the way of the cross. Saint Teresa of Avila would say, you don't need the devil to push you to hell. If you don't meditate, you will go to hell. And she said specifically, most of the time she was meditating on the passion. And sometimes she would describe that she would be crying over this passion. At first I said, why would I cry? But as you go into the practice of meditation, there are some moments that you can cry. And it's the motion of the Holy Spirit. So these are things that are accessible. You do not need yoga meditation, because remember, it's the power of the enemy. You don't want to be with them. The Buddhist meditation. We have our own Catholic meditation. Unconditional love of Jesus through his passion that started way before he was born and manifested during the Immaculate Conception of the Virgin Mary. All these things have benefits in your brain, the gut, overall health, the telomeres, and your soul. Well, if you like this video, please like, drop a comment, let's discuss. Tell me about your experience. Please share, because it's not just you who probably would need this. And don't forget to subscribe because you will be informed of future videos that we will be producing. This is Medicine and Faith podcast, I'll call it video. Until next, we will be talking more about the benefits of the unconditional love meditation on the Passion of Christ, on how it heals us, both mind, body, and soul. Thank you.